Hello and welcome to our video about the causes of smelly breath. What is causing my breath to stink? If you've noticed that you're getting worse with time, it may be a sign that you've got a serious ailment such as GERD, azotemia, or poor oral hygiene. If so, here are some ways to get rid of smelly breath. Listed below are some of the most common causes of smelly breath. Also, be aware of the foods you eat. GERD. If you've been experiencing persistent odors coming from your mouth, chances are you have GERD. The condition is caused by acid from the stomach backing up into the esophagus. Food bits get caught in the acid and cause bad breath. Some patients aren't even aware of their bad breath, but it's still an unpleasant symptom. If you're suffering from this affliction, there are several things you can do to minimize your smelly breath. If you're experiencing persistent heartburn or acid regurgitation, chances are you have GERD. However, some people may experience symptoms without any signs of heartburn, including hoarseness in the morning and difficulty swallowing. Besides smelling bad, people suffering from GERD may also experience a dry cough, foul breath, and a chronic sore throat. There are also some lifestyle changes you can make to reduce your GERD symptoms. As mentioned above, GERD can lead to smelly breath. As acid rises in the windpipe, it can trigger the vagus nerve, which tells the lungs to constrict. This condition leads to bronchoconstriction, which can also result in wheezing or shortness of breath. Asthmatics also commonly experience a combination of heartburn and GERD, including regurgitation and dysphagia, which are symptoms of GERD. Lifestyle changes such as avoiding smoking and alcohol can help prevent or control reflux. Some people experience a flare-up of GERD, in which the problem becomes so severe that it eventually leads to Barrett's esophagus and food pipe scarring. For those who can't take the pills, surgery may be the only option. This procedure will attempt to repair the junction between the esophagus and stomach. Azotemia. The causes of azotemia are many. Some occur spontaneously, while others may be due to a disease. Here is a discussion of common causes of azotemia. It is important to note that azotemia and smelly breath can be caused by different conditions. It is important to consult a doctor to find out the most appropriate treatment for your case. Listed below are some tips on identifying and treating azotemia. Treatment for azotemia involves the use of medications that increase renal perfusion. These medications help maintain urine output and prevent the symptoms of azotemia. Some of the medications include adrenergic drugs, corticoids, and diuretics. However, these medications aren't always appropriate for every patient. The best treatment for azotemia is to consult a doctor as soon as possible. Genetic disorders can also cause smelly breath. A genetic disorder called isovaleric acidemia causes a buildup of leucine in the blood. Combined with an underlying illness like renal failure, the symptoms of this disorder may lead to smelly breath. In some cases, the problem can be life-threatening. Another condition called trimethylaminuria results in the deposition of trimethylamine, an organic compound that is responsible for a fishy smell in the breath. Other causes of azotemia include a kidney disease, diabetes, a urinary tract infection, and a chronic condition. A thorough history and physical examination are required to diagnose and treat this disease. Specific laboratory tests such as urinalysis and creatinine levels can help in determining the cause of the smelly breath. If the azotemia is chronic, dialysis may be necessary. Poor oral hygiene. Some common causes of smelly breath are bacterial infections, dry mouth, and poorly fitted dental devices. Other causes include intestinal tract infections, diabetes, and kidney or liver problems. Although most of these conditions are treatable, some people have problems with their oral hygiene. If you have smelly breath, you should consult a dentist to determine the root cause of the problem. In the meantime, you can take steps to eliminate the odor and maintain a fresh breath. If your breath smells unpleasant, it's likely caused by poor oral hygiene. Although 90% of halitosis originates in the mouth, it can be a symptom of a more serious health condition. If you're concerned, it's important to see a dentist to rule out a dangerous dental infection. In addition, a dentist can help you get your breath back on track by providing tips for better oral hygiene. The first step to removing odor-causing bacteria is to brush your teeth. You should do this twice daily, as bacteria live on your tongue. Using a mouthwash or floss will help get rid of trapped food particles and bacteria. Flossing is also essential to remove food particles and plaque from between teeth. A mouthwash with alcohol-free formula should be used before bed. And remember to visit a dentist for regular cleanings. In some cases, poor oral hygiene can lead to gum disease. Your dentist can diagnose and treat gum disease and prescribe appropriate treatment. Oral health is an integral part of overall health, so making sure you take care of your mouth is key. If you're constantly tempted to smoke, consider visiting your dentist for professional advice. If you're a smoker, you should seek medical treatment immediately. If you smoke, it can lead to oral cancer. A good dental hygiene routine is essential to avoid halitosis. Foods eaten. There are several causes of smelly breath, ranging from improper oral hygiene to smoking. Bacteria feed off the carbohydrates in food particles and produce smells. Some of these foods can also be staining to the palate and cause bad breath. But there is a simple cure for smelly breath. Listed below are 5 foods that cause bad breath. Watch to discover the best remedies. Listed below are some of the most common culprits. Acidic foods can make your breath smell awful. If you're suffering from acid reflux, you should avoid acidic foods. The bacteria that cause this odor thrive in acidic environments, so limiting these types of foods can be a big help. Acidic foods can also make you more susceptible to having smelly breath. So, how can you fix your bad breath? Listed below are some easy and effective tips to get rid of your smelly breath. Aside from food particles that get stuck in the teeth, certain foods can produce a foul odor. If you do not brush your teeth regularly, they could increase bacteria and thereby produce bad breath. Furthermore, some foods produce breakdown products that enter the blood and are carried to the lungs. Moreover, if you have a dry mouth, it's more likely to produce smelly breath. In addition to the odor-causing foods, the mouth also produces saliva, which naturally cleans the mouth. Melons contain large amounts of vitamin C. This helps in creating an unfriendly environment for bacteria in the mouth. Besides, their high water content also keeps bad breath bacteria away. Other food products containing chlorophyll can help as well. These plant products can help improve your breath, while others are more folkloric. They might not work, but they can help to improve your breath. So, if you want to eliminate smelly breath and have a great breath, try eating melons regularly. Diseases. The cause of bad breath can be a number of things, from an acidic stomach to a metabolic disorder. Other possible causes include GERD or gastroesophageal reflux disease. In young children, foreign bodies in the nose can also contribute to smelly breath. To help prevent or cure halitosis, talk to your dentist and get a thorough examination. Some medications can cause smelly breath. Symptoms of GERD include recurrent, chronic cough and wheezing, and recurrent upper or lower respiratory infections. A swollen throat can cause an overpowering odor in the breath. In a similar vein, a bacterial infection in the lungs can also lead to smelly breath. Those with GERD should have their lungs checked immediately, because infection from an untreated infection could lead to a rotting odor in the breath. If the problem persists or is chronic, halitosis could be a sign of a more serious medical problem. The presence of cavities and deep pockets in gum disease can also cause bad breath. As long as the cause is diagnosed, proper treatment can be found. Symptoms of halitosis can range from temporary to permanent. You may also need to see a dentist if you have a persistent case of smelly breath. Bad breath is the most common symptom of a number of medical conditions. Bacteria that produce fatty acids and malodorous compounds can cause halitosis. Research shows that between 80 and 90% of mouth-related halitosis cases can be traced back to bacteria in the tongue. Because the tongue is relatively dry and poorly cleansed, large quantities of naturally occurring bacteria are often located on the posterior dorsum. The tongue's convoluted microbial structure provides the ideal environment for anaerobic bacteria to flourish under the coating of the tongue. We hope you enjoyed the video and would like you to like, comment and subscribe to our channel for more reviews every week.